All right, we're going to go ahead and get started, everyone. Thank you for jumping on and joining the beginning of our webinar series. And we'll go through, this is the first part of a three-part webinar series that is focused on driving clinical outcomes through making great hires. One of the areas that we feel working with our clients are one of the biggest struggle and stuck points in any organization is identifying the right organizational fit for the programs that you're offering from a care management perspective. So to get started, we're going to just outline, again, this is webinar 1, Understanding Your Landscape, which we view as a very important part of the process on the front side is really getting a good handle of your starting point. Webinar 2 will be held on July 20th, which will be focused on taking that information to build out a more sustainable plan. During that webinar, we'll be covering culture matching, training and creation of supply, benchmarking top producers, and essentially building out the ideal profile of what you're trying to look for any of your programs. August 24th, we're going to extend that into more of the execution and evaluation and reevaluation of that plan. So we'll go through tools to aid in the hiring process, looking at the benchmarks that have been set and start to reevaluate. And then we'll start to adjust qualifications based on actual results by looking at different analytics and reporting that you can compile to make better decisions long term. To kick off, before I start off the webinar, just to give you a quick background on Medix and myself. Medix is a healthcare workforce solutions company. We've been in the industry for roughly 15 years. I've been with Medix for 11 of those, solely focused in the healthcare world, with the last really 5, 6 focused in the care management space specifically. And really over the last 10 years working with health plans, managed care organizations, ACOs, medical groups and hospitals, really have identified some of the biggest challenges of making sure to match the right people based on some qualifications. So to focus on what we're going to be covering today, we are going to be covering the care management industry overall. We feel that the care management title, the name, everything is very elusive today based on the explosion in the industry. Second thing we're going to cover is the supply and demand in the space around care management overall. We'll talk about the shifting landscape from a competitive standpoint, and then we'll start to identify your own individual company culture that has to be assessed in truly understanding your landscape on the front side. So first to dive in, what is care management? It's a very confusing area in the industry. One of the, I think, out of a ton of topics at last year's National CMSA event, this was probably brought up in 60% of the presentations, was just the confusing nature of the term and the misuse of the term across the industry. What license is it? What background does someone need? What experience level from what facility types does it come from? It's a very broad term. So the first thing I wanted to do is kick off to have a good understanding from a definition standpoint of what is care management. And by definition, as you can see on the screen and read, it is a very broad term. It's a very high-level macro vision look at it. Basically, it's defined as a set of activities designed to assist patients in managing medical conditions, with the aims of improving the overall health status, enhancing any kind of care coordination, get rid of duplication efforts, and overall the big goal is to reduce the need for expensive medical services and start to have a better control of the cost on the preventative side. As I alluded to in the previous comments, the skill sets vary dramatically, from RNs to social workers to licensed professional counselors and health outreach workers. In addition, even nurse practitioners sometimes fall into this bucket, and we've had some other innovative programs that we've worked with around the country that have started to utilize EMTs as well. And so when you're looking at this, the spectrum from a worker standpoint, when you think about supply and demand and you think about the dynamic of what's happening, it's really cross-functional, and we have to look across all categories. So the big elephant in the room is always supply and demand within our space. And with 80% of people in this space being more on the RN nursing side, that's where we're going to focus a little bit at first. First, yes, there is a nurse shortage, and there's going to continue to be. And there's a lot of drivers that is driving the demand in this space, which is causing a lot of pressure on supply. So we're going to run through some of the major triggers that are affecting demand piece by piece here, and each of these individually alone could be manageable. But when we cascade a lot of different programs and a lot of different economic situations, they all cascade together, creating a overall waterfall effect. And then we'll take a look at more the supply side itself and what's happening within the supply arena of staff that fall into more of the care management arena. So first dive into more of the ACA impact. And this is not all ACA encompassing. This is just really the one major piece of it, and that was the regulations around individuals required to have health insurance. You can see at the end of 2013, more around Q3, Q4, that's when a huge spike happened in individuals obtaining insurance that have never had it before. So we went from 18% of individuals in the United States not having health insurance to only 12.9 within a one-year period of time. And I know that number has continued to decline as more and more people obtain insurance. So you're talking about, when you look at the overall U.S. economy, you're talking about roughly 11 million more people that are falling into the category of now having health insurance. And one of the big avenues here is a lot of people are paying a good amount of money for that service, and a lot of these individuals have never had health insurance before. So one of the first things that they're going to do is go to the doctor. So you have a flood of individuals with now having coverage that are wanting to utilize that coverage, which is putting additional stress and pressure on the healthcare system overall. The second big trend is a lot of the programs that are causing a major shift from fee-for-service into the managed care sector. And specifically, I'm going to focus on public sector programs of Medicare and Medicaid. So here's a graph. The first graph here is of Medicare private health plan enrollment, which is really what we're talking about, is the shift into more of a privatized managed care setting. You can see since 2005 the dramatic increase in the number of individuals now going through managed care health plans that were not before. And when you get into the ratios with Medicare, quick question? Was there a question there? Okay. If you could put your phones on *6 to mute. Thank you. Specifically around the Medicare space, there's been a big growth of enrollment, and essentially the pressure and demands on those individual plans to hire additional care coordinators, care managers, and case management staff to be able to support that business. A very similar trend is existing in the Medicaid space. Here is a graph that outlines Medicaid expenditures across the country from a state standpoint as well as from a federal government standpoint. Obviously with Medicaid being a state-run program and a lot of the regulations within ACA has pushed a lot of funds into this space to help get control on more of the complex care and a focus on the individuals that are costing the system the most money. So you can see where we're at today as well as potential projections into the future. Nothing but additional growth from a federal standpoint as well as more and more state funding money coming into these programs. Again, the one thing to stress is these are high-touch individuals that are usually a lot more complex and need additional help. Combined with both of those influxes in membership, you have a major issue of the population of 65 plus. So we're talking about individuals that are now starting to need a lot of this care, and they're getting to the point where they're falling into potentially the Medicare space as well as increase on the private side. When you're looking at the population shifts from a 10% of the population to over 20% of the population being 65 plus, that is a major shift in demographics across the country that we need to be very, very cognizant of and understand that 65 plus, people are living longer than they have been, and there's a lot of drivers for that. But the major thing that we need to take in consideration is your 60s to your 80s are not your 20s to your 40s. So these are individuals that are going to start needing additional support even outside of the programs they're enrolled in. So that's, again, putting more pressure and more demand on these types of skill sets. Lastly, I wanted to outline more of the snapshot of the workforce. So this graph is a membership demographics for the Case Management Society of America, and this graph is from 2012. I have had conversations within the past month with CMSA, and the number of demographic-wise, it's almost identical to where it has been. And I wanted to use this specific graph because if you look at the number of members, it sits right around 10,000. From a statistical analysis standpoint, I felt like it gave a good round number for us to work with to understand as a snapshot. And these are pulling individuals across the board that are in case management, care coordination, and again, 80% are probably going to fall into the RN category, but there are a lot of social work or even community health workers that are sitting in this bucket as well. So when you look at the supply snapshot, 74% of the people in this industry and taking care of people today in leadership roles across the organizations today are over 55 years of age. And when you look behind that number on the individuals born between 1960 through current, there's not a ton to replace the bigger number of that 74%. You know, one of the things that have been somewhat corrected is the output of nurses from a nursing school perspective. And that has increased over the years. But unfortunately, it's not up to the standard of everything falling off. So it's something that we need to be aware of in the next, really 5 to 10 years. We're going to be losing not only the workforce within this industry, but the knowledge base within this industry. And those are things that we need to make sure that we're really focused on succession planning long term. So the last thing from a supply and demand standpoint that I wanted to cover is really where you're located matters. Everyone kind of intuitively knows that. But again, looking at how these different slides overlap each other is an important thing to take into consideration. So this first snapshot is really kind of a heat map on where the largest percentages and the smallest percentages of seniors live. This is something obviously where anyone 65 plus lives, there's going to need to be a higher population of care coordinators or case managers or nurses or social workers to be able to help that. So the darker parts of the map are a higher percentage of the overall population of those counties. So most likely if you are located in those counties or your businesses or your service areas are in those counties, those are probably some of the areas that there is extreme high demand and probably a lot more pressure on supply than ever before. So you're competing for the top talent against probably a lot of other organizations as they centralize around those areas. The second one goes along with some of the conversation we've been having around the ACA. And, one of the big pushes from CMS has been around different models of care and innovation and trying hundreds and in some cases thousands of different types of models to test and see if this works. And the federal government is very vested in trying to figure this out. So they've obviously partnered to try out innovative programs in a multitude of different practice settings across the country. And this map really outlines where there are state-level run different models. And those are the squares, the orange squares on this graph. And then you have the blue circles, which are healthcare facilities that are taking on new innovative models as well. So again, a lot of these models are centered around preventative care management, population health type models, which again is putting pressure and stress for them to find additional people to work in these programs. So again, lay this over the graph with the 65 plus, and then you have even more pressure. Lastly, we saw the numbers around Medicaid and the growth within Medicaid and the focus of funds around Medicaid. Medicaid expansion is causing a huge stress on supply within our space. And again, to outline this graph, you can see where the 32 states that have adopted Medicaid expansion, there are multiple still in conversation. And then there are, in the orange, you'll see the states that are not adopting right now. Again, there's a lot of different legislation state by state that is progressing things forward as things change weekly, sometimes daily, around where things are going. But when you focus on expanding the population that is now considered Medicaid, you're talking about, again, increased number of supply within those spaces. And again, we're not talking about increase in commercial membership. We're talking about increase in Medicare and Medicaid and sometimes the dually eligible programs and special needs programs where it's extremely high touch, boots on the ground, and ratios to take care of this population are very, very low. So something to consider as you outline all of these things combined. Again, like I said at the beginning of the webinar, when you look at things individually, it's easy to shrug it off. When you combine all of these things together, it creates a very tight marketplace for the type of people that can work in and support to drive your individual organization's outcomes towards what you're trying to achieve in your programs. So again, alluded to this, really it is a complete war on talent in our industry currently. The competitive landscape has completely really exploded. It's not just hospitals, health plans, and a tiny bit of third party. Now you're getting into hospitals that are focused on better transitions of care. They're held accountable due to more the readmission penalties, and they're really focused on even inserting themselves into the health insurance world. And you have those combo type environments. You have the emergence of ACOs and really passing that risk and doing shared risk programs, really with the providers taking that directly on themselves. You have the health plan that is also looking at the collaboration between health systems and providers overall. Then you dive into even population health management companies and the emergence of a lot of different third-party niche organizations that focus on engagement and population management. Different models of even the patient-centered medical homes popping up all over. Telehealth, the expansion of reimbursement now hitting physicians, where physicians can bill for telehealth out of their practice. Now they're starting to onboard in local medical groups and direct with the physician themselves, starting to launch those type of initiatives. The long-term care and the managed long-term support services obviously are already kind of the norm from a growth perspective around this space. And then lastly, the bottom left is, I have that as more of a mobile phone because the emergence of telemedicine as well as virtual medicine, not just telehealth, but you're talking about patient monitoring, data analytics, huge explosion within healthcare technology companies in the care management space and really the patient monitoring and patient interaction space. And that's becoming very disruptive to the marketplace because it's kind of blending both. More of the long-term strategy around care management and direct providers. So the last thing that we really wanted to dive into was taking a very honest look at your company and your culture. So again, this whole first session of this webinar is getting a very good baseline for the landscape you're dealing with. And really starting to break down your entire organization on who you really are, where you're going, and what you really need to get there. The first thing we always look at is, how do your current employees view your organization? Because those are the individuals that are really representing you to attract great talent. It's those individuals that are saying, hey, come work with me, come work at this organization with me because this is a great place to be. And around Net Promoter Score and focusing on driving that north, one of the statistics is that positive Net Promoters will definitely promote you, but negative individuals in your organization will bash you way more than people will prop you up. So this is something to understand where you currently are with your organization. Again, looking at yourself honestly. Number two is really, which goes along with number one, is how do the potential candidates view your organization? and again, this isn't how well your marketing is done. This is not what your website looks like. This is really the true view of what people think, what people are talking about. What's the buzz around the industry around you? As we all know, the care management industry overall is a very tight-knit group. And you can mention one company name, and they have a gut feeling based on leadership or people they've dealt with within the organization or around the organization, and they pretty much have a feel for the culture very quickly. You have to understand what your perception is in the industry. We've recently worked with a couple of different clients, and we've had people go through the interview process and decline multiple offers because they're afraid of what they've heard buzzing around the industry, around that organization. So it's something that you need to be very cognizant of your entire organization yourself. Secondly, it's looking at, or third, you've got what are the true barriers that you have that are holding you back from finding and attracting the best talent. Everyone's going to, especially if you're more in the nonprofit space, you're going to have the challenges around pay and potentially even location. And that's where stuff you have to consider of how many competitors you have around you, what type of city landscape, rural areas are you in that may be causing some pain. And then lastly, tying in with number 2, could your company's leadership or view of the organization and how it's run be a barrier to attracting talent? Number 4 is probably what we see the most in working with organizations across the country, and that is the disconnect between the human resources or talent acquisition within an organization and the clinical team. Most of the time, obviously, human resource and talent AC is dramatically overworked, and they're covering multi-department coverage. And a lot of times they don't necessarily understand what's needed from a clinical perspective to help you find the right talent to drive the outcome that you need. We've seen tons of organizations that have struggled with that. So being in sync with your human resource team is a huge sticking point. And lastly, again, which ties in with number 4, is are you hiring for your program or are you hiring just for your job requirement? And that really comes out within that relationship with the human resource team where they understand not just a job description, how many years of experience you're looking for, the licensure qualification. Those are all kind of check boxes for us. You really need to understand the type of personality, cultural perspective, and passion around what that individual can bring. Most of the programs we've worked with around the country have phenomenal programs, and we've watched them fail. And they're not failing because the program is bad or the process is bad or the system is bad. They're failing because they're hiring the wrong people that don't fit that program and don't understand that population, don't have empathy for that population, don't know how to work with that population and demographic. And that's usually the biggest disconnect. So to pull kind of all together here, as you go through understanding your landscape, you'll start to realize how much that tightens up who you're looking for. And not only are we in a huge shortage across the country for the right staff, so it's easy to fall into the trap is I just need somebody. It's so easy to fall into that trap in today's environment. But it starts narrowing it down to where hopefully you're not just putting a job posting out and sifting through 400 people, but you can start to identify and build out what you're looking for so you can have more of a targeted approach for success. And really that starts with understanding what is care management in your organization. Because I can tell you it is different in every single organization. what does supply look for your organizational fit? When you go through the landscape evaluation and you see where you sit, what does really supply look like for you? What is driving demand and why? Again, we went through a bunch of different things that are driving demand. Your specific geographic location and what is happening from a legislation state, from your state and both federally, might shift that. But what is happening for you? The shift in competitive landscape. Understand what's around you, the different types of programs, and what landscape's been created in your state. And then probably the most important is your company culture. And not even necessarily maybe what your company culture is today, but working with the leadership across your company to understand where you want your culture to be. Because if you want to continue to stay status quo from a cultural and performance standpoint, you hire the same type of people that you always have. If you want to move forward and step forward in your organizational growth, you really have to identify what's going to take you to the next level and push you forward. And that's really what you want to focus on when you're understanding that true company culture. So lastly, guys, I wanted to note here that we are going to be in Long Beach here in 2 weeks. I don't know if anybody else potentially on the call that's heading there. We will definitely be in attendance. We'll have Lauren Filarski, Taylor Rose, Jenna Ronis, and Tom Green. They're some of our care management experts across the country. Lauren's based out of Chicago. Jenna is in California. Taylor is in Arizona. And Tom Green's in our Nashville location. They'll be at booth 745 if you want to kind of get a head start on future webinars. And again, the thing to note is we are planning on that July 20th as the second webinar, where it's really kind of pulling all this information together. You take time to absorb and do the research to understand where your landscape is today. Then you can start building a solid plan. And in that next webinar, we are going to be covering more on how do you build a culture that matches your program, how do you incorporate the right training for those individuals, and get to the point where you understand how to create supply. Because we all know that supply doesn't just hang on a tree to go pluck off. We are going to have to get to the point where we get creative and create supply. We want to look at how our timelines from a hiring perspective align very closely with the products and programs our organization offers and or is going to be also be launched in the future, because we want to time those up and get way ahead of it. And then really understanding how to benchmark your top performers. And I'm not just talking about the people who have been there for 15 years. I'm talking about the people that are performing at the highest level and understanding why they're performing at the highest level. And from that information, we'll round out to really build out what I brought up earlier was that targeted approach that you can find the right people. So when you start pinpointing and searching for people, you know exactly what you're looking for. You're not sifting through a bunch of people and hoping they fit. You know what fits, and you can start pinpointing the right talent. So if you want to get a jump start on that webinar, definitely jump over to our booth at CMSA, and we'd be happy to answer any kind of questions that you may have and help out ahead of time as well. You can just ask for Lauren or Jenna, Taylor or Tom. They'll definitely be there. So at this time, I'm going to open up for any questions or comments. I know we've got a couple throughout typed over to me via chat. We'll hit those after, but I wanted to open it up again. You are all on mute, so *6 will unmute you, and feel free to jump in with any questions if you have any at this time. right, doesn't look like we have any questions from the people on the phone, so I'm going to go ahead and dive into a couple of the questions that were asked as we were going along. One of the questions was asked was, where can I get more specific information on the supply and demand for my specific area? I know we covered stuff from more of a macro standpoint, so we can definitely take a deeper dive for you. Feel free, my email is on the screen. If it's too small to read, it's kwilliams@medixteam.com. Feel free to email me directly, and I'll get you with our healthcare analyst here at the company, and they'll be able to provide you the right information to hopefully help you better understand your landscape to help make you have better decisions. The second thing was someone wanted to know if we'd be able to provide the slide deck. Definitely, if you're interested in getting the slide deck, please email me directly for the slide deck, and I'll work with our marketing department to make sure it's more of a consumable fashion for you moving forward. Okay, those are the two questions that came via the web. Any last-minute questions from anyone out there? Perfect. Well, I appreciate everyone taking the time to jump on. And again, remember our next webinar, second part of the series, will be conducted on July 20th. And that will be really focused on taking the information after you've had time to do the research on your landscape to really build a sustainable plan to move forward. So I look forward to talking to everybody on July 20th.